My name is Anna Marie Sinatra, the CEO of Sinatra Solutions, a coaching, consulting, and training firm that partners with you to catapult you to the next level in whatever it is that you're up to. Whether you're an individual that wants to sharpen your skills professionally, maybe it's leadership development, maybe you're the owner of a business and you have employees that you have to manage, maybe you're a manager, we can do that together. And if you're a business or an organization and you want to create those peaceful working atmospheres where your employees can work together as a team, we can do that with diversity training and conflict resolution and soft skill training. We can do it. We can partner together to get you where you want to be.
Hi, I'm Ava Sammarco, the practical nurse. I enjoy bringing you current and up-to-date health information for today's changing world. And I do this by hosting Health Focus.
And I host Health Matters.
And we collaborate to bring you focus on health matters.
So before we get started, we want to thank some of our sponsors. We want to thank Mattress and More, where Maddie Mattress is educating us in a variety of ways on how to get a restful sleep. You could never believe there's so much information when you're looking for a new mattress. If you have problems getting a good night's sleep, maybe you have some injuries like I did, knowing all the different details about those mattresses is so important, and he's doing such a fine job in educating the community.
Go right to sleep.
Yeah.
Also, we'd like to thank Western New York Imaging Associates, Dr. Frank Mascaro, providing state-of-the-art imaging equipment to assist you in your time of need. With many locations throughout Western New York, Kenton MRI, Lockport MRI, and Western New York MRI, downtown Buffalo, and his equipment in several other facilities throughout Western New York. Yeah. You'd be surprised.
Yeah, you would be. He's like all over.
Wow.
Yep.
Great.
And we want to thank Joe DeMarco from Wings Flights of Hope, where his volunteer pilots are flying sick children and people all over the United States in their time of need, whether it's a transplant service or, somebody gets that call in the middle of the night. God knows if you had to call the airlines, you pay a fortune. They have volunteer pilots that stay on call waiting for you to call them. So without any further ado, you want to tell them about making sure they got those pens and papers.
Pens and papers.
So you take lots of notes and let's get started.
I'm going to talk about my favorite subject today, nursing. Yeah.
That's pretty good.
Everything you wanted to know about nursing, but we're afraid to ask.
Oh, I like that. I think maybe you need to write a book about that.
Oh yes, inquiring minds want to
know
about the world of nursing.
If you write the book, will you sign it?
Yes, I'm going to have a book signing for my fans.
Yes.
But today, to share with the exciting world of nursing, we have from Trocaire College, we have Susan Lombardo and Marian Meyers. And you know what? They're going to fill it in about nursing.
That's
and
right.
what
Maybe
we
you
need
should
to know.
Collaborate with them, and we should get a really great book going. How about that?
Yeah. And then it'll be a bestseller.
But thank you, ladies. We're so glad that you came on the program today to help to educate the community all about Trocaire. So tell us a little bit.
Well, thank you for having us. We're very happy to be here. And let me tell you something about Trocaire. Firstly, Trocaire means mercy in Gaelic. And that's what the college is all about. Looking at students from diverse backgrounds, giving them all the dignity and self-worth and self-enhancement through education. We're in South Buffalo. We're right on Choate Avenue in Abbott near Mercy Hospital. And it was founded by the Sisters of Mercy in 1958.
Wow.
And we not only have nursing programs, but we also have like radiologic technology, surgical technology, computer technology, hospitality management, health resources. So we have about 13 programs.
Wow.
The largest of them, though, are in the nursing program. We have about 1,400 students.
Wow.
1,400, wow.
Yes.
So would you say too, the graduating classes are really large on the whole, right?
They are. We had 250 this this May. Right? Yeah. We've nursing school started 45 years ago, and so far we have 8,000 graduates who've graduated from the nursing program.
Wow.
Yeah.
That's great.
Yeah. It's a large program.
Right in the heart of South Buffalo.
Right, Mercy.
That's a beautiful
Mercy.
area too.
Yes.
Just
Across the street
beautiful.
from Olmsted's Casanova Park.
Yes,
Right.
yes, which I love to visit very often.
Yes.
That's beautiful. And today you wanted to focus a little bit about the new changes that are coming about, correct? Yes, you want to tell us a little bit about that?
Yes, well, as Dean Meyers said, the Trocaire College has a large nursing program, or nursing programs, I should say. There's a practical nursing certificate program, an associate degree program in nursing, and most recently, within the last 2 years, the development of a baccalaureate program in nursing, baccalaureate in science nursing.
So why did they start that, Sue?
Well, the reason why a lot of these programs are coming up across the country is because of this new legislation. In fact, there was a report by the Institute of Medicine talking about increasing the education of nurses overall, going from 50% of nurses with a baccalaureate degree to 80%.
Wow.
That's the goal.
Wow.
And that is coming to fruition throughout the country. And so we need a better educated workforce.
Wow.
In addition to that, the New York State Education Department is encouraging nurses to have a baccalaureate degree. They call it a BSN in 10, meaning in 10 years that they would get their baccalaureate degree. Not to say that the associate degree would not still be valued, because those nurses will be at the bedside, will be taking care of individuals. The baccalaureate degree extends beyond that to more of a population leadership management focus.
Wow, that is
So
amazing.
And you know, we have an associate degree program, and so when we began the baccalaureate program, our idea was to give them an academic pathway in one college, so that they could go from associate degree directly into the bachelor's degree. And a lot of the associate degree students come in not very sophisticated about college. The associate degree gives them 2 years to get used to the college ways. And then by the time they get to the baccalaureate part of the program, they're comfortable and they're more likely to be successful. And they can earn money to pay for that baccalaureate degree.
And I think what I heard you say, Sue, was that they'll have those who are already in position with an associate's will have over 10 years to work towards this new goal.
In some areas that's true. Locally, in fact, we just were with the Catholic Health System the other day, and they are hiring associate degree nurses with the stipulation that they do have to get their baccalaureate degree. They like them to be enrolled in a program. I believe, and I don't want to misquote, I think Catholic Health is looking at something shorter than 10 years. That's their own personal preference. A lot of the hospitals locally are going up for what we call magnet status, which is something that is provided by the American Credentialing Center through the American Nurses Association. And so with this magnet status and the hope that these hospitals will become magnet hospitals, they will have a more educated workforce. They will have the 80% registered nurse with a baccalaureate degree as recommended by the Institute of Medicine.
Wow.
So that's what's happening locally. So getting a bachelor's degree in nursing, whatever route you wish to take, is so important right now.
Right.
And,
What about
I'm sorry. I was just trying to interject. Nursing is so complicated now. It's so different. There's so much technology. The shift is going away from acute care in hospitals into the community, back into the home.
Right.
You really have to have more time to incorporate all the knowledge that is out there. So I think that this is inevitable, that we prolong the education of a nurse.
Oh, absolutely, because so many people are already out there. I know when Ava and I first started talking about, you two coming on and talking about this, that's the first thing I said, well, how does this affect those who are already in position, and should they be scared with new legislation coming down?
No, they'll be grandfathered.
Not to lose your job, in other words.
Yeah, they may be grandfathered in, but as you said, certain facilities may require or look towards those who
mandate you,
or even mandate.
Well, that's what's coming, but the people who already have these degrees, until the legislation is really passed, so to speak, will be grandfathered in, because there is still a place for the associate degree nurse, and there's a place for the practical nurse too. And we want to be sure that, you know, everyone understands that this is not for everybody. They're even looking at just 80%. So there's that 20%, you know, that will be practical nurses or associate degree nurses. So there's value in all types of education. But in addition to legislation, there have been some studies in the past couple of years that are looking at the fact that patient outcomes, in other words, how well the patient does post-operatively after surgery, how well they do after any kind of healthcare issue, how they can actually improve patient outcomes by a better educated workforce. And while we're talking about the associate degree, we also know that nurses who, or while we're talking about the baccalaureate degree, I'm sorry, we also know that associate degree nurses can also learn things through continuing education, going to seminars and so forth, and they can add to that increase in patient outcome as well. But we are very excited about our program in the promoting the baccalaureate degree.
And also I've seen some studies about how much happier a baccalaureate prepared nurse is because, number one, wage premiums, they go up.
Right,
And,
exactly.
they're into,
You can do more.
Yeah.
Like, for instance, I was talking with Anna Marie, you know, before the show about research and things like that. They're on the research level, the grant level. And teaching, you could do a lot more teaching. And
there's another good one. We have to educate our nurses higher and higher up the level because we're running out of faculty. How can we prepare people when we're so competitive here in the Buffalo area? There's 5 viable nursing programs all looking for faculty. And like at Trocaire, some of our faculty are probably ready. I shouldn't say this, but they may be retiring.
Be careful, you're on air.
So we have to replenish that, and if we encourage nurses to get a bachelor's degree and then a graduate degree, now we replenish what we need.
Now, for those that are in position, that they're nurses already and want to know more and learn more, they may be wondering about the cost factor as well. And I think we were talking earlier in the green room about some tuition discounts and grants. Tell us a little bit about that.
At our particular school, we do have a Dean's Scholarship, which automatically takes 20% off of the current tuition at Trocaire College.
Oh, nice.
Now, Trocaire College is a private Roman Catholic school, so you know, the tuition is competitive, however. In fact, I just did a little bit of research in the last few days about the local schools and what the costs are. But we do offer a 20% discount to our baccalaureate in nursing students. And if you do happen to be an alumni from Trocaire, we do offer an additional 30% off for the first 6 credits per academic year. But we are looking into other strategies as well, because we are attracting nurses from other, like, community colleges, Erie Community College, Niagara Community College, and so forth, and we want to bring those people in as well. So we are offering the 20% discount for people coming back, and there's all kinds of funding out there, actually, because there is a push to educate the workforce, and we're starting to pursue that in many ways.
Especially with nursing, because you'll always have a job.
Right.
If you don't like one avenue, you can go to another avenue. Exactly. And that's what makes it so flexible and so, you know, so much easier, because you're not, you know, if you're burned out at one, you don't have to stay there for 25 years.
That's right.
You know?
I have been
you don't have to worry about a computer taking over your job either.
Exactly.
I have been in nursing since I was 20 years old. I've never been without a job. I've never interviewed for a job. I've always been sought out because there are so many opportunities, and not only in nursing, in other areas as well.
That's right. And you must, Marian, you must have seen a ton of changes.
Oh my gosh, yes.
We are trying to prepare our nurses in our baccalaureate program for the changes. For example, we have a course in nursing informatics because in the hospitals, everything is the electronic medical record.
Yes.
Right,
And the
right.
student really needs, they're working, but they need to really look at what's behind that,
Right.
why it's important. So we have, some things that really speak to the changes and also the current population, which is a diverse population. We have courses in multiculturalism. We have courses, one course that's a big seller is one called Race, Gender, and Literature, so that the student is really open to the diverse population.
Oh, yeah, because you're going to run into a lot of cultural diversity.
And world religions, which is
Yes.
very, very
Exactly.
important. Yeah.
Right, right. What do you think makes a good nurse? I'm just curious. What's your take on that?
Well, people say that you're born to be a nurse, that you have a passion for a nurse, that's how you begin. That wasn't what it was with me. When I was 20 years old or 18 years old, teacher nurse, period. So
That's true. If you
I
go
thought
way
it's
back.
true.
Yeah, you didn't have a lot
Yeah.
of career options in front of you.
So I really didn't love nursing until I was a nurse. And my education was fine, and that was a little tedious, and so on and so forth. I was in a diploma school. But when I finally got to interact with people and make a difference in their lives,
Right.
and they touched me back, that
Exactly.
was when I
That
loved
was it, exactly.
So we talked a lot about nurses that are out there now to understand this new program. Let's go there a little bit more about the new people who may be sitting, some of the young people who might be watching today and wasn't even thinking about considering nursing as a career. Let's talk a little bit about all the different avenues that are available.
Yes. Well, there is a predicted nursing shortage. People have probably read about that. So I wanted to touch on what Dean Meyers said as well about the faculty shortage. There's a faculty shortage and a nursing shortage. So we have both of those things occurring. It's a great profession to go in. As Ava mentioned, there's so many different avenues people can take. You can work in the hospital. You can work in the community. You can, as you said, do research, teach. School nursing is an option. Community health, public health. There's so many different things that you can do. And we want to talk a little bit about, too, the educated workforce and the different professions that are also going for higher education, such as the pharmacists now have to have a PharmD, a doctorate in pharmacy. The physical therapists' entry to practice is now a doctorate in physical therapy. And we want nursing to be able to use a cliche, sit at the table with the other educated
In other words, be
professionals.
competitive.
At a level.
So at a level that
Exactly.
we can all relate to speak, and this interdisciplinary concept is so critical to the patient care because that's the bottom line.
Really is.
So,
Right.
yeah.
And Ava, how does that affect you too? You're doing visiting nursing.
Visiting nursing. I heard, though, at visiting nurses that they are hiring new grads. You can work there as an LPN, which is a licensed practical nurse, or a registered nurse. And that's great, too, because I like doing home care. And, with your experience with med-surg, you can use it in home care also with it. So, in other words, if you're burned out in the hospital, like I did 2.5 years, that was enough.
Yes, I remember that. That's kind of be very overwhelming. That's
is.
a good place to go too about support systems when you're providing such intense care at times. I know, there's a saying that we have, every good coach, as I'm a coach, every good coach has a coach, and then in therapy, every good therapist has a good therapist.
Yes.
What kind of things do you have in place to be supportive for the nurses?
This is so timely that you're asking that question. Because we are currently developing a mentoring program for our nurse faculty at Trocaire College. We're in the process of writing that because there has been, as you mentioned in your field of coaching, there has been a lot written about the support system that nurses, that faculty, and so forth feel. And sometimes they can tend to feel isolated if there's not somebody to bounce things off of. So whether you're a staff nurse, and many of the hospitals, if not all of the hospitals, are doing mentoring, or a faculty member who also needs that little, extra, this is what I did when I experienced that.
Yes.
So this is absolutely true.
We're trying to dispel the saying, nurses eat their young. You know, we're trying to say, no, you can't do that.
Wait a minute.
Yeah.
I don't think I've ever even
Yeah,
heard
nurses
that one.
eat their, I hear it, yeah.
You're trying to
Yes,
dispel it. You
that's
might wanna-
one of the things.
Now I'm like
yeah.
stuck on there like, what?
Sometimes nurses can be a little bit curt with somebody that's just a new
Oh.
student
Yes.
and withhold information because they want to feel like they might know a little bit more. And so they can sometimes, and that's how the phrase goes. Nurses
Right,
Well, let me
nurses
tell
eat
you
their
that you
young,
could
yeah.
say that in any, being a coach and a consultant, when I go into businesses, I can't tell you how much I see of that.
Is that
It's
right?
amazing. I'll go in and help to create some internal systems, whether it's or diversity training or whatever it is. Go in, and sometimes it even takes me a long time to get to the bottom line. It may take a month sometimes, and I
Right.
go, my goodness, why didn't you give me this information in the beginning?
Right.
So it's not just for the nurses. It might help you to feel a little bit better, because I'm in all kinds of different places. So
Right.
it's unfortunate. And so it's nice to hear that you have an internal system that's going to help to dispel this and help to promote collaboration and cooperation.
Exactly.
Yes,
Because
and the national-
sometimes,
Key.
the key. I'm sorry, Sue. The thing about it is that it might make the difference whether somebody stays at a job or
Yes.
not, because
Absolutely.
it's so crucial. And also too,
It's absolutely.
yeah.
Not even Mike, Ava, I would jump on that and say it's absolutely the
Yeah,
difference
I agree.
between sustaining
Yeah.
a good employee.
One of the larger
Right.
hospitals in towns, I just found out, loses 50% of the new employers, or new graduates in 1 year. 50%, that's big.
Wow.
That's big.
Wow.
Like for mentors for students too.
Yes.
Okay, do you have that, or a lot of they were doing that too?
We have advisors. We
Yes.
have people who advise them. We have each faculty member has a group of 10 to
Yeah.
15 students that
that they can go
that
to.
they see on a regular basis.
Okay.
Some schools do pair students up with somebody else. Like if you're in a four-year school, a lot of times they will pair the freshman with a senior. So it's kind of like the baby, you
Right.
know, that they nurture
Exactly.
along. But there is good support at Trocaire College for students. It's
Oh,
good.
that just
In
makes
fact,
me
we
so
were
excited to
recently-
hear you talk about this.
Yes,
Yeah.
we were recently congratulated actually from our accrediting body, which we can talk about
Yes.
later, about the resources that are available to our students at Trocaire. Exceptional for a
Wow.
college of its size. The resources and support are tremendous.
So please don't wait till later. Tell us about
No.
it now.
Yes.
About the accrediting, about where we are in the
Or the
accreditation process, or the resources?
Either one.
Either one.
Either
Well,
one
the
in both, actually.
Well, the resources that are offered at Trocaire from the library, which is exceptional, and everyone who comes to Trocaire does make a comment on the exceptional library that we have, the resources that are available there. We also have a lot of people working in student affairs, there's student activities. It's a good supportive atmosphere. But
the simulation laboratory is outstanding. We have a birthing mother, a real electronic.
birth?
She gives birth.
Wow.
She
An
has
electronic
she has
birthing
a
mother?
placenta. She has everything.
Got everything.
She
Wow.
can have a cesarean section or a natural birth. We can have codes on these mannequins. They're all
Wow.
electronic.
You know, I'm feeling another show coming to Trocaire
Yes.
College,
Please do.
so that we can
because we wanna
do
see
some
how it's born.
hands-on.
Yeah.
I know. It reminded me when I see the students going around with the little baby, the electronic baby.
Yes.
Yeah.
So
Yeah.
and they said that that's really working
Yeah.
too.
Let's hope
I
so.
would love. Wouldn't it be fun to go
Yeah,
and do
would
a
be good.
program
Yeah,
on
that'd
that?
be
That's
great.
We'd
incredible.
be happy to have you.
yes.
You know, we're really winding down. Time just flies, and I'm
Ooh.
just wondering if there's anything that you want to really make sure that you
Yes,
get in.
I do. We do. Our baccalaureate in nursing program began in 2011. That's when we admitted the first students in the spring of 2011. It's very important that programs become accredited. You know, this shows that we are meeting the gold standard. We had our first accrediting site visitors in February, and they have recommended us for 100% for 5 years. But we still have
that's
two.
wonderful.
We still have two
Congratulations,
more
yeah.
processes to go through. We're going to Atlanta in June to appear before the review panel, and then finally it will be the commission. So we've made it through the first process, and we're very excited
Wow,
about that.
that is amazing.
So hopefully it will work out in our
Congratulations.
favor. We're very excited.
Well, we're just so grateful that you came to share all this information
it's our
with us
pleasure.
and
Yes.
with the
And
community.
you solve the inquiring minds.
That's right. That's
Thank
right.
you very
Solve
much
the
for having
inquiry.
us.
Thank you. Thank you for sponsoring
Yes,
this
thank you.
program today and sharing all this amazing information with the viewers so that they can get in touch with you. And we're just really glad that you watched, that you tuned in. And I'm always so happy to get your emails and your calls. And you're so excited about this program, as we are too. And we're thanking Donna from Miracle Water, one of our newest sponsors. We're excited about her coming on board too. And we just want to hear from you. So keep those emails coming in.
Yeah, you gotta keep writing them.
Yes, and remember, stay focused.
Because your health matters.
Thank you, Eva and Anne-Marie, for giving us this additional time. We'd like to share some important messages about how we wish to support the registered nurses in this community.
Yes, the way that we do this is that we recognize, first of all, that the registered nurse is generally working full-time, has a family and other obligations, and we've provided an online program for our baccalaureate nursing program at Trocaire. The student can come full-time if they choose to, and they can complete their program in 16 months if they come full-time. But we also encourage those who have other life obligations to go part-time, and that's certainly a possibility. We have them taking a couple courses a semester, and one of the ways that we also help them is that we offer the courses each and every semester. We admit in the summer, the spring, and the fall, and we offer every single course each semester, so the student never has a lull time. They can continue to work and take classes. And the online delivery is such a convenient delivery mechanism for people who are working, because they can be up in the middle of the night doing their coursework. They can do it on the weekend. They can do it on holidays, whatever is convenient for them. And we're very pleased to be able to do that. We also give training in how to do the online course so that the student is not puzzled when they come to take an online delivery course. A lot of times they're anxious, but we have support. We have a great director of IT that's helping. The director of technology assists the student in navigating through our learning platform on the computer so that they're never puzzled. They have answers to their questions 24 hours a day, 7 days a week. They're never left alone having a question that can't be answered. So we're really supporting the registered nurse and the working individual as well.
Thank you very much, Sue.
So thank you for watching. We really appreciate your emails and letting us know that you like all the programs that we're bringing you. We want to know if you want to be interviewed on this program too, so keep those emails coming. And we have a couple more sponsors to thank. We want to thank Mr. Frank's Barbershop and Beauty Salon. Yeah, you heard me, Barbershop and Beauty Salon.
Wow.
This used to be her dad. She's been there forever. And then she became a beautician, and now her father has since passed, and she stays there on that corner, providing all kinds of services and educating people on hair care, and she does medical pedicures. So as you start to get when you start to get a little older and you can't get down there to take care of what needs to be taken care of, there's ways you can do it.
Wow, that's neat. Wow. Also, the Healing Spa with Marge Reed offers holistic, non-surgical facelifts, facial chakra balancing, color and light therapy, and many other therapies, helping to bring the body into balance wherever it is needed.
So keep watching, keep emailing us, and stay focused, because
your health matters.
See you next time.